So I just think about all the different generations and how each generation really eats differently. We don't think about our baby boomers and how they have different eating patterns to now students and millennials or Gen Y. I think that's the newest generation, right? They all just have such different eating habits. I mean, we all love food across the board, but it's really just about those habits and how we grew up.
Hi, my name is Aislynn O'Kelly. I'm a second-year Master's of Public Health and a Dietetic intern here at UT Health in the Nourish program.
Hi, my name is Dolores Woods. I'm a registered dietitian and I work for the Nourish program at UT Health School of Public Health. So the goal of Nourish is to really be the nutrition hub at the Texas Medical Center. We focus on bringing the Seed to Plate curriculum to healthcare professionals, our community, and our dietetic students so that they are able to really know where good food comes from, how we can grow it, how they can cook it, and ultimately how we can use it so that people can have a healthier lifestyle.
Yeah, what I really love about the Nourish program and, being a student here is how hands-on everything is. We're actually out in the garden, we're actually in the kitchen, we're in the simulation lab, and we're actually being able to use our hands to practice the things that we've been learning about.
Right, and it really helps you retain all the information.
Yes, definitely. Here at the Nourish program, being a dietetic intern, I've been able to see, emerging trends, using social media to get health information out there, making infographics that are easy to read and have evidence-based information on them, learning how to put those together. And then here in the kitchen, learning how to do culinary medicine, learning about what foods and how to prepare foods and how those foods can promote the long-term health of individuals. We learn about how different physicians can write food prescriptions and how patients can go to a food pharmacy, for these individuals that might have or might be in a lower socioeconomic status. They might not have the funds to go out and buy fresh fruits and vegetables. These physicians are able to write a prescription so that they can take food home, and I think that's an amazing trend that's coming up in the healthcare world.
With our program too, we have our kids camp and we have our little kids coming in and we can teach them how to grow food, how to cook so that they're able to just be exposed to that. I think that's really important. And, a lot of times they can educate their parents. And if a kid likes something here, if they like those roasted carrots and they go home to mom or dad and give them those ideas, they're going to be much more open to that. So I think that's also something that, we forget about, and it's really important.
Yeah, definitely. What initially comes to mind thinking about food as preventative medicine is thinking about, the things that, I don't want to say trendy, but the things that are kind of evidence-based right now, like thinking about fiber for gut health and for cancer prevention and omega-3s for heart health, and then making sure that even individuals with diabetes, making sure that they're, watching what carbohydrates they're taking in, making sure that's consistent, using that food to prevent further complications of their diseases. As an intern, I've been able to see, how we're taught here at the School of Public Health, very kind of the whole person rather than just maybe the one disease that they're having. And, we take into account socioeconomic, we take into account all of this things that make a person a person.
It's just sometimes cheaper, unfortunately, to go out and get some fast food instead of shopping for healthier foods.
Yeah.
I think one of the biggest challenges is the lack of time. Everyone is so busy. We're all overworked and overwhelmed, it seems. So sometimes people just don't have time to cook. And I know that's something that we really try to promote is cooking, even if it's once or twice a week, just so that you're able to make healthier choices and really control what you're serving as opposed to maybe going to a fast food outlet. And so I think that that's something that if we can teach people how to cook easy, fast, healthy things, that could really help address that.
Yeah, definitely. Time is such an issue whenever you've got kids or you have your own things going on, that it's nice to, have the resources to know quick and easy recipes, to know how to use the microwave to cook vegetables, it's just, it could be as simple as that.
Exactly.
New media like social media and just how easily accessible it is for people to access health information, whether that be evidence-based or not. You can just go into Google, pull out your phone and search like what's healthy now. And so I think it's kind of hard to, be an evidence-based practice, be, dietitians and dietetic interns, where we're really fighting against that current of kind of misinformation, where people can be their own expert, it seems like.
I think that's one of the most challenging parts about being a dietitian. I know I find myself constantly debunking myths. So a lot of times it's just, I feel like we just have to be a little bit louder as a group, just so that we can make sure that all of the accurate evidence-based information is out there. Yeah. It's wonderful when you do have access to all of this information, whether it's social media or videos. So maybe we just need to do a little bit better about making sure that we're pushing all of the good stuff out there.
Pushing our good stuff to the top. Because, people have access to recipes and cooking videos and stuff. So, I mean, as frustrating as it is to wade against the misinformation, there's still opportunities to, use that and say, hey, you can get on YouTube and you can look at how to cut a vegetable, or you can read more about it at this website. It's nice that there's so much information that's readily accessible.
Right.
There's two sides to the coin. Whenever we think about how easy it is to go everywhere in the world now, you're able to see different foods and different food trends and ingredients cross border lines. And so it's so cool to see how ingredients that might not have been available in Texas or in Oklahoma, you're able to see like Vietnamese and African and Indian influences over in the States. And, the other side is that the Western diet, the Westernization, has been moving to these countries. And that includes, an increase in fast food, an increase in convenience food. And, with that increase, you see a correlation of an increase in obesity, an increase in diabetes and other comorbidities. So, it's great that we're all connected now, but, there are some detriments to that. So we want to make sure that we're trying to get an increase on the good stuff.
And I mean, unfortunately, people want to adopt these Western diets, and they forget that their own cultural foods are probably better for them than a lot of these processed foods. So it is another challenge that we are faced with.
Yes. And that's what I love about Nourish and about the cookbook too. We're not whitewashing food. We're not whitewashing nutrition, There's healthy foods in all cultures. And so I really like the emphasis that this program and that the cookbook have on, or they emphasize that. Yeah.
Definitely.
Yeah, I think the cookbook really emphasizes, how generations can work together and how food is passed down through families. It's these recipes that are simple and that have a wide variety of ingredients. There's stuff that's on the more young side that has like kale and like salad bowls and stuff like that. And then there's also things like collard greens in there that really appeal to, maybe the older generations. So it's just a great way to kind of bridge the gap between everybody, to find common ground, because that's, between everyone, food is really where we find common ground.
Back in the day, right, it was focusing on food, and then we got into this processed food fad, and then started thinking about, well, low fat is good, fat-free is good, and then now we're sort of back maybe full circle where we're thinking more about food again.
Yeah.
When I first started working in food service, it was a very different way, the way we would cater to our students, especially the college-age students. And so the menus would change constantly. And I know now customization is so big, and that's really what people want. Before it was just like, this is your combo, this is what you get, and that's really interesting too, how just from, like a hospitality perspective, it also changes how we provide food.
Yeah.
And, that was one of the goals with the cookbook, also just bringing that food forward perspective so that people can think about actual real ingredients, whole foods. And so hopefully we're not, moving back to those days where everyone thought margarine was good. And now we know, well, no, that was actually not a good idea. And I think that's one of the really interesting things about nutrition too, is that it's changing. It's a changing science. And at the end of the day, it's whole foods and your fruits and veggies, and that's what's good for us. This cookbook really focuses on making vegetables and whole grains the center of the plate. Yeah. And so really getting people used to having more vegetables. And I think that's important just because we know there's a lot of data out there that people just are not eating enough vegetables, and they're actually very beneficial for us. And so having something as simple as more vegetables during dinner can actually go a long way when it comes to someone's health. Yeah.
Yeah, and I think that, the cookbook puts it in really simple and very readable terms where you're not reading a scientific report. You're reading this beautiful cookbook with pictures and vegetables and tasty recipes. And so that makes it a lot easier to care about your health whenever it looks good and tastes good.
Right, exactly. And I also think that it could be used as a resource. So next time you have a dinner, if the whole family could get together and follow some of the recipes, I just think it really helps families come together. Yeah. Different generations can, grandma can be there, grandpa and mom, dad, and all the kids. And there are some recipes that will appeal to every single person in there.
Yeah, definitely.